You can see now?
Refresh it now.
Oh my god, I didn't. Maybe. Can you watch?
Oh, did you go on the YouTube thing yet?
Yeah.
Yeah.
They start screaming here.
Yeah.
Excellent connection.
Oh, there.
Yeah, no,
Now
it's on.
coming. It's on. Okay, good morning everybody. Once again, today we're gonna start the lower limb. I know we're supposed to go to wrist, but I'm gonna review muscle first, right? And then if I have enough knowledge to talk about the other muscles, we'll go there later. But let's finish the major muscles and nerve in arms and legs. So today we're gonna start the lower limb. Below the knee, because we don't have shorts today, so we're gonna go lower part first and then side part later. So if this is the tibia is gonna be your home base, and wow, his muscle is so big. This is the gastroc, underneath is the soleus, and then I think we have to change the depth. Deeper. So if we go deeper, there's a triangular muscle popping out, right? That's the triangular. Can we have more gel? Wow, here's like, are you a runner? Yeah, so I mean, we got the wrong model. Or good model. Okay, so once again, tibia, your home base. First muscle popping out is soleus. Because that means I'm a little lower part of the leg. Can you see it? This is about 1/4. From the knee to ankle, 1/4. The first muscle what you see is the soleus. Can you change the gain? Gain is the B. It says B, yeah. Make it white, yeah. So here, first muscle is the soleus, but I'm gonna go up. If I go up, the first muscle is gastroc, right? Gastroc. And if I come down, first muscle is going to be soleus. So if you're a beginner, don't confuse the soleus and gastrocs. Okay? So here, when you see this type of, there's a home base in the tibia, right? And the first muscle popping out is the soleus, not gastroc, which means you are not at the knee joint area. You are already about 1/4 below or distal to the knee joint. But I'm going to go back proximally again. Look carefully. Now gastroc become first muscle, right? Which means your proximal part around the knee joint. So many times when we start to teach you guys are confused that, oh, that's when I put my probe here, which is about 1/4 distal to the knee joint, you guys say, oh, where's the gastroc? You're gonna hit the first muscle, but that's soleus. And then how do I do that? Oh, thank you. If I move my probe to the posterior part, look at this, gastroc is popping out now, right? I'm moving my probe to posteriorly. Can you guys see it, right? Posteriorly. So Ray is a runner, so you can see his gastroc is very well developed. And then so here soleus coming out. I'm moving my probe to the anterior part. And then here 1/4 you start to some triangle muscles. Right? Triangle, you can see it? That's the toe flexor. Flexor digitorum longus. Ray is moving his toe flexor. Can you grab my finger with your toes and relax? Relax. See? And then I'm gonna move my probe longitudinally. So look at this, longitudinally. So you cannot see the gastroc anymore. Soleus and toe flexor. Now, second toes. Okay, third, fourth. Actually, if we train, we can individual muscle. That's the flexor digitorum longus. Underneath is gonna be posterior tibialis. I'm gonna move again. Transverse way. So now make it deeper a little bit, because Ray has a long leg and thick leg. So if you look at here, look at the probe site is about 1/3, proximal 1/3, right? Between the knee to ankle, proximal 1/3, where you can see posterior tibialis better. Now, can you freeze that one? Oh, one more time. I'm sorry. His leg is not yet. His leg is not baby's leg, so maybe this could be better.
Here?
Oh, he's really deep. Next time, when we change the model, it's going to be a little different. Can you stop over there? So here, cursor, right? Oh, no, why it didn't? Cursor is in here. Yeah. So this is the triangular muscle. Underneath is we can draw, right? Measure. And then from here, and then this is the posterior tibialis. How do I know? Here, actually, cursor. This square is the posterior tib. So it looks like a chair here, like this, sofa, right? So when I see this posterior tibialis from the medial side, I say chair muscle. Looks like a chair. But here actually, I'm sorry guys, cursor. No, I cannot do anymore. This is the artery actually. Artery moving here. Okay, we can erase that one. So, just clean, yeah, and then unfreeze. So here, so if your patient has thin legs, like me, I'm pediatric physiatrist, but if you are adult physiatrist, when you do the stroke patient, their calf is thick, let's say, or someone who's a young person had a stroke, their calf is very thick, and then you have to use a 7 centimeter length of the needle to get to this deeper. If you look at the depth from this screen, it's about what? 1, 2, 3. About 6, 7 centimeter, we have to go deeper. So you are approaching your needle like this, straight down like this. From here, it's too deep to approach from the medial side to the posterior tibialis. Then what you're going to do, now I'm going to switch. I'm going to move patient leg like this to the front. Then let's say here, wow, so good. So, you know, very soon we have to change the model because he's like, but look at this, his anterior tibialis, left side of the bone shadow, you can see that's the post tibia, right? Left side of the screen, bone shadow tibia. And then interosseous membrane. Good. That's the there's artery. Can you put the color flow? It's what artery is. Anterior tibialis. Artery. That one, yeah. So that artery, as you move your probe, is going to change the side. See? To move it. It's going to the middle. From the lateral side, it's moving, right? So when you do the posterior tibialis injection, oh my God, he has such a beautiful posterior tibialis. All the hyperechoic, God bless you. I have no time to say. All the hyperechoic part is the anterior part of the leg, but the dark square part is the whole posterior tibialis. So if your needle is 5 centimeter length, you should approach posterior tibialis from the anterior part. So if you look at the screen, I'm going to approach from here. So you can see the muscles are moving, right? Oh, do you have pen? Maybe. Oh, yeah. Where is this one? I think in the drawer. They locked everything. Thank you. So if you look at the camera part, this is my needle, right? And I'm gonna, so posterior tibialis motor points or end plate zone are in between proximal 1/3, middle 1/3. So when you do the posterior tibialis injection, you have to start from the proximal 1/3 and the middle 1/3. So in the middle 1/3, you should drop the botulinum toxin, otherwise it takes time toxin to crawl to the end plate zone. So I'm going to approach here, and then you can see the artery part, right? So you can avoid that artery. So your needle is going to be in the arrow, yellow part, and then you put, I'm going to push here, you put the pen, this is pen, but this is the needle, put like this. Here, this part, I cannot do it. So this part you're going to put it, and then about, when you put the 4 centimeter, a little more than 4 centimeter down, you're hitting the posterior tibialis. The whole square is the posterior tib. But one thing you have to be careful is that if your needle, can you freeze that one? Yeah. So what I was going to say.
No, I didn't freeze it yet.
Did you freeze?
No,
Oh,
I started,
you can do
I
it.
started by accident.
That's okay. Yeah. It's, I found a better test. Yeah. So look at this. Let's make it square. Just toggle a little bit, make it clear. Okay. So here, if we can freeze. Okay. So here, oh, sorry guys. So this is the tibia, right bone shadow. This is the all anterior part of the shin muscles here. But this is supposed to be a whole posterior tib, right? That's the major. Oopsie dipsy. I need application answer. Okay, I was thinking. Ooh, this is the whole posterior part, right? Posterior muscles. This is the posterior tibialis, but if you do injection very close to the tibia part here, okay, you will hit the actually flexor digitorum longus. So how do I know? I always use nerve stimulator guidance together with ultrasound guidance. So it's close to the flexor digitorum longus. If you hit the medial part of the tibia area here, so please do not go too close. Try to drop botulinum toxin in the middle. After you avoid vessels, you can drop any places, but not too close to the tibia area, because I found multiple times your toe flexors are moving instead of posterior tibialis. Okay. And then I will finish here anterior part. You guys can practice, right? So here, let's make it deeper. So now we know posterior less deep, less depth. Yeah, less depth. Much less. So we're gonna focus on anterior part of the tibia, shin. So look at the shin part. So this is very proximal part. The knee is there. I'm coming down tibia, our home base. First muscle popping out is anterior tibialis, right? Here is, since this is very proximal part, there's no extensor hallucis longus. As you come down, now Ray is going to bring his ankle dorsiflex and inversion. Push against me. So that's anterior tibialis. Less deeper, make it deep. Less, yeah, much less. So not to confuse people. And then if I slide down about proximal 1/5, the EHL start to come out actually. Bring your big toes up, or I'll move it
To the right.
Relax. Actually, in between the extend, to be honest with you guys, it is extremely difficult for me to isolate EHL between EDC. Now he's moving EDC actually. Push against me. Can you see good facial line here, right? See? Look at this, right? Very nice. But EHL is very hard. I don't know what is EHL, right? So here, let's say, I think we can, this is all peroneal muscles, but these things here, I think his EHL seems to be very big. Okay, push your, I'm gonna move his, yeah, that's great toe, right? But the next is EDC, push against me. Oh, that's the EDC actually. Hold on a second. He's, I have to differentiate between fibular muscles. Relax a little bit for me. So see, look at this guy. Peroneus longus. Here, still Peroneus longus only. As I go down, Peroneus brevis popping out now. See? Do you see? The dark one is popping out underneath. That's Peroneus brevis. So Peroneus brevis comes around the distal 1/3 from the knee joint. The dark one. Can you point it out? Okay, I'm going to do now. In the middle. Pay attention to that part. The distal. Below that. So I'm going to show, not yet, it didn't come out yet. I'm going to show it's popping out now. See? Did you see the black one popping out? Yeah, that one, yeah. So can you, here, brevis popping out. So longus is above, but longus is big. His muscle, especially his muscle. So those two, looks like a fascia line is all peroneal muscles. These two muscles here. And then here's the ED, extensor digitorum communis is this square one. Yeah, that one. So we're gonna do it again. So EHL is very hard. Still EHL, we don't see it. This is the knee part. And I'm coming down extensor, anterior tibialis. As I move laterally, extensor digitorum coming in. Extensor digitorum longus, right? Can you freeze over there? But look at the raised leg. We only came down about 1/5 or less than 1/5 from between the knee to ankle, right? About 1, 2, 3, 4, 5, 6, 7. 1/7 from the knee joint. That's the picture. 1/7. And here, first square. That one is the anterior tibialis. Next one is that's the extensor digitorum longus. Next one is the peroneal muscles already, Peroneus longus. But Peroneus longus looks small, but actually very big for the young people. Okay, how do I know that's Peroneus longus muscle? Because there's bone shadow. Can you show the fibular? Yeah, that's the fibular. Above the fibular is going to be the Peroneus longus. Okay, unfree. Oh, can you save that one, P1? And then no. Start from proximal part. So we're going to go down. So here is very difficult to differentiate. But even though I go down, it's not easy. Oh my God, his muscles. Now you have to change the depth, right? We are trying to find out extensor hallucis longus. Oh my goodness. It's already full muscles are together. Here, anterior tibialis and then extensor digitorum longus in between. Because already when I go here, yeah, we need a little more gel. Now I'm in the middle of the shin. If you see, can you see anterior tibialis and extensor digitorum coming longus and EHL? You cannot. Fascia line is here now. You can see a little bit, right? Right. So now, as Vera says, if we go down, can we see EHL, the fascia line better? Yeah. So we are there, right? The picture. So, can you move his big toes?
A star on his big toe.
Maybe push against your finger. You have to do
No,
that.
the other way around.
The other. Don't move. Let her move. Relax. So you can see in between. One more time.
Hard for me to isolate.
It's very hard to isolate in the ultrasound. Okay, relax. Let go. Push against me. My finger. See? Downstairs over there, right? And then now move your whole toes. Push against me. So the upstairs is the extensor digitorum longus. So
So just
The-
need to look at initiation of the, like in the very beginning.
yeah, do EHL again.
Yeah.
See,
Yeah, that's
low
good.
part, right?
Yeah. Mm-hmm.
Can you
Which makes sense. it
can you
should
hit
be
the
different.
P1? Okay, move your big toes, push against me, push, push, relax, and then move your toes,
Yeah.
push against me, right? So EHL seems to be lower, extensor digitorum longus is proximal part, right? P1 and save that one for me. So we can make the PowerPoint. Okay, so now you guys make sure that I know usually anterior tibialis motor point is about from the tibia tubercle, 3 finger breadth, about 1 finger breadth. This is the motor point. We're gonna study nerve later. For now, today we're gonna study the muscle first. But here, so when you do the posterior tibialis and anterior tibialis at the same time, you chose this place, right? 1/3 between the middle third, right? You go anterior tibialis from here, and then you go directly go down straight down to posterior tibialis together. But as we took a look, EHL is very hard to differentiate under the ultrasound guidance. So you rather use nerve stimulator guidance at the same time, right? And then I'm gonna move my probe to go back and then to the lateral side. Here, lateral side above the fibula is the peroneal muscles. This is all peroneal muscles. It's big, Peroneus Longus, and then Peroneus Brevis is popping out here now. Here. Can you do P1 over there? Okay, P1. I'm going down. Now you can see the Peroneus Brevis is popping out. Okay, very good, right? So Brevis, the reason why we are talking about Brevis, because the Peroneus Brevis is much tighter according to orthopedic surgeons. If the patient is spastic diplegic CP, has a valgus foot, they actually ask us to do more botulinum toxin injection to Peroneus brevis than longus, because much tighter when they open it. So you should know where is the longus, where is the brevis. Brevis here is getting bigger. So when you take a look at the anatomy book, sometimes the brevis is lower than they put together, like longus is above, brevis is down to Peroneus longus, but some books says like side by side. But actually you can see it, it's like they overlap. So you want to practice that part from this position.
Alright, first you're still okay being a model? Let us know when you're tired.
Then after better, baby, better lay down.
Yeah.
Yeah, we can have better look.
Not bad.
Are you a runner too?
Oh, okay.
Are you a runner?
No.
Okay.
I'm in. No. Definitely not.
Since so you flipped over, so I don't confuse the
True.
yeah. So your home base is
yeah. So here's so the knee, and then I'm going slightly below. Can you increase the depth a little bit?
already.
Yeah.
So put your home base a little less. No, for her.
Yeah. So we start to see.
If you are not social like this, and then you move your probe to the posterior part to see if there is Gastrocs or Soleus. That's Gastroc, right?
Yeah.
So here, Gastrocs start first, and then you scroll down. Soleus popping out now,
Oh yeah. Awesome.
right?
That's what I was looking for.
Yeah. You can change the gain a little bit for her to see better. Make it wider, make it darker. Yeah. You have any comment?
Yeah, so on ultrasound, it's not as apparent, but if you look at more like 3D models or other pictures, gastrocs surprisingly thick. So that was really something that was kind of leaning on when you look at it. You think of the calf muscle, gastroc is a big muscle, but as you come down, you can already see that Soleus.
Yeah, Soleus is big. Yeah, Soleus is big. We know that. That's why that's the really important muscle for us to do push off, right? So you should not make the soleus too weak. So when you do the botulinum toxin injection to the calf muscles, do not weaken the soleus. You rather weaken the gastrocs because that's the really main muscle which is helping the push off. If you weaken the soleus, the patient is gonna start to crouch.
Because during the stance
Stance,
phase,
it's very
yeah,
important.
during the stance phase, the soleus is
Is the one.
eccentrically contracting and limiting that forward motion of the tibia.
Otherwise,
So if it's too weak, the tibia just keeps going forward and you crouch.
correct. Okay, so make sure that when you do botulinum toxin injection, even though they have, so you know how to examine the ankle, right? Ankle dorsiflexion with the knee extended is checking the gastroc tightness. Ankle dorsiflexion with the knee flexed is soleus tightness. Unless the patient is quadriplegia who are not really community ambulator, you should not touch the soleus. So mainly your injection is going to go to gastrocs with the toxin.
There's a fancy name for that test.
Yeah. Okay.
Silver skull.
Silver skull.
No,
Silver
that's
skull.
that's uh,
I don't, me either.
Right,
Okay.
I'm at
Always
about
having that.
1/3 distance from the knee to the ankle, and
Mhm.
right now I can see gastroc on top, and then soleus in the middle, and then flexor digitorum longus.
So flexor digitorum longus,
Longus.
you have to, now you don't see it, right?
Yeah.
Triangle muscle. This triangle is actually soleus, right? And
Right.
then as you go, now start to pop out, the triangle popping out, right? That's the toe flexors. Okay, underneath is the
Tibialis
posterior. Posterior, good.
And this is the biggest part of what we have to see here.
Yeah, from the medial part. Oh, I have to assist it. Okay.
Wait, you do for a second, I'll come back.
Oh, come here. Yeah. Okay. So I'll be over there. Okay. I'm gonna change the depth first. Okay, very beautiful. So before we had very little gel, that's why you couldn't see well. Now you highly change the direction of the probe. Now we're gonna change it back. So left side of the screen is the home base, tibia, and I'm gonna bring it up to review the anterior part. So this is the anterior tibialis. You're gonna talk.
So most superficial is tibia anterior. And then if we come more laterally,
So
we should
this
see
is the
EDL.
extended digitorum longus.
Longus.
Perfect.
And if we come distal,
So now the
the
look
shell
at
should pop
the
in.
look at the artery is moving. Okay. So continue. This is the posterior tibialis. Move fast to look at the. Actually, here you guys did not see it. Actually, there is a peroneal nerve here. The peroneal nerve. Okay. Next to this artery, very small. Mm-hmm. The you toggle. It's hard to see. Go back and forth. So you guys can see this is the artery. Next to the artery is the nerve. It's very hard to see here. And then when we study nerve, we're going to track it down, okay? Continue. So now posterior tibialis is here. And then let's go to peroneal muscles. Here you can see already, I see posterior tibialis, not the posterior, brevis, peroneal brevis is popping out, right?
Yeah. So
And then why don't we scroll down to all the peroneus muscles? Yeah. See, brevis gets bigger, a lot bigger here. I think that's why the surgeon is telling us to take care of this one better. Okay, good. Coming up, now disappeared. So By the time it goes over 1/5 from the proximal, I think it already. Where are you?
So more proximal 1/5 here.
1/5.
There's
Okay,
nothing.
now let's go downstairs and see.
Downstairs from here.
Now popping out
Starts to
now.
pop
How
out
much?
At about a third,
What?
right? I would say
1/4. 1/4.
It's a quarter.
From the knee to ankle.
Okay.
Okay. Come down, down, down. Alright. Looks like nerve is here. Okay, then you wanna go medial part?
Restart on the next one.
Yeah, medial part. So your
Yeah,
home
you
base,
flip
you
it.
flip over again.
Oh wait, this looks weird again. Okay, so medially we have, let's see, gastrocs, right? Because we're start at the knee, we're coming down. First thing we see is gastroc, soleus, this more distally. Then we have the triangle there.
Here, let's do this longus underneath
You know,
the
posterior
stair from this. All the things are posterior tibialis. I'm gonna change the depth. And if you lose home base, sometimes you get too confused, right? But here, this is the gastroc, this is soleus, this is the flexor digitorum longus, this is the posterior tibialis. We still didn't see the flexor hallucis longus yet, right? Because if he raise a child, we can actually see when we approach from the medial side. But since his leg is thick, we cannot see the fibular part. The flexor hallucis longus starts from the fibular area, from the fibula, with proximal 1/3.
You can see from the back, I guess, right?
Yeah, so that's why when we do the adults, we have them lay on their belly to look for it.
Got it. Okay. Where else?
So, did you finish the medial part?
Not-
Vera
I
is gonna
finished
finish
it.
the
I
medial
didn't-
part
I
and
didn't
then,
finish the lateral part actually.
and then we're gonna have
You want me to-
Ray on the
I'll
prone position, right?
So wait, did I flip it over?
Yeah.
Yeah, so that's good. So now we can see tibialis anterior in the center of the screen on the top, and then tibialis posterior below it, and then we can see a few vessels actually. But
Here,
yeah.
okay.
All right, and then if I go more lateral, I start to see extensor digitorum longus, which I think is that drop leg muscle in this case.
Where you are in the mid 1/3, right? Go down a little more. Here, this is gonna be the
Yeah.
flexor hallucis longus area. This is gonna be.
Yeah, and digitorum is on top of it, like a drop, right?
Not the flexor, extensor hallucis
Extensor.
longus. What am I saying?
What did I say? Flexor?
Sorry,
Sorry.
no, she said. You said extensor.
Yeah.
Yeah.
I said that.
Okay, and then we start seeing more lateral. We start to see peroneal
Peroneal
muscles.
muscles. This is all peroneal muscles. Here, let me just measure this one. And then I'm gonna start from here. Oops.
Now
oops,
we
oops.
see
Sorry guys. Oh my
mostly
god. I
longus.
cannot. What
Wow,
happened to me?
that's
Oh
good.
my god. No, I'm in the wrong. What happened? I cannot.
That's
Because this is we didn't
You have to freeze it.
freeze. I'm sorry. Okay, now I'm gonna do it again. Measure. So let's start from here. Oh my. Why is not coming? Okay. From here, this is the bone, right? Being in this side is not good. Oh no, I think my problem is not the.
Oh, that's better. That's
Yeah, this is better.
Yeah.
Oh my god, I don't know,
It's
sorry
just
guys.
mountain lens.
Oh my. This supposedly this is all peroneal muscles.
So think
Uh-huh.
Brevis didn't start coming up, right?
Brevis
yet,
start
right?
came out
At about a third.
the-
a quarter, you said.
1/4.
Yeah,
From
but
the
From the knee,
one
but,
quarter
knee.
distance from the knee.
but I don't see it yet. Let's see.
No, actually,
I
let's
think
take a
it's-
look.
You think it's there? Let's
I can look for it like this one to me,
maybe there.
clear, and then you go unfreeze. See here, now
Yeah,
you can
now
see
it's
better.
there. So I was here.
Yeah, where
and
are
now,
you?
And now I'm.
It's
now
popping
I'm
out.
Here. Yep.
Let me put my cursor here. This one. So now you have to toggle to show the, I think, facial line
Yeah. now
here.
it's
Yeah, so it's become like very not clear.
So that's where it starts.
Uh-huh,
And then
and
if
then
I go lower,
Lower,
they
lower,
kind of
lower.
melt
So
together.
here, this is the facial line. Here, facial line, facial line. So if you look at it, by the time you go to the ankle, actually, Peroneus Longus, you see tendon,
Yeah.
but Peroneus Brevis is
It's
still muscles there. So when you look at the sural nerve, you are looking for the Peroneus Brevis rather than Peroneus Longus to look for the sural nerve. We're gonna do that later, but this is the way you can see Peroneus Brevis is such a muscular, big muscles compared to the Peroneus Longus. We don't really pay attention to peroneal muscles, but as you practice more, you see a lot of patients has bad foot deformities from the hypertonia. And then you can do Peroneus Longus Brevis. Some patient is Peroneus Tertius. Okay, so go back.
So that's the base, and then if I go laterally, I can see here I can already
This
see
is
longus and
nervous area.
brevis. And then as I go distal, 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 it's mostly brevis, and there is no longus left.
Well, it's very hard to see.
Here I
superficial
can see
peroneal nerve.
longus, and then brevis beneath it. And now as I go distal, it's mostly brevis. And no
Uh-huh.
longus.
You are already like middle 1/3, right?
Yeah, I'm
That's
already
why when I
almost at the
recommend
ankle.
the Peroneus Brevis injection, I usually ask you guys to come from the malleol line, lateral malleolus, about 1/3 from there to the
Yeah.
injection.
That's
Yeah.
about how it goes, okay. Yeah, makes sense.
Okay. Then there's a towel, I think. Towel here.
Yeah. And then we can switch. I can be a
Thanks,
model.
Eric.
I'm gonna go from first, so we can show that.
But then you won't do anything. I mean, in
No,
terms.
but we're
Yeah?
just gonna show
Yeah.
that.
Okay.
Fibular.
Thank you, Ray.
Because he's a senior.
This leg.
I don't know.
I
Oh yeah.
know,
I tried to see how the leg shows.
She's like, I know this.
Yeah, he knows everything. So this
Yeah,
leg
this
shoots,
leg.
but which side is that? Right side leg.
Yeah.
Yeah.
Yes.
Yeah, this one's
This
Yeah, right side
This one's
leg.
different, yeah.
So I should start from here. So let's start from in the middle. In the middle, can we see the popliteus?
Yeah.
You guys, can you see the nerve is moving, the pennation throughout the pennation? The vessel next to the vessels, tibial nerve is in the, oh my, wow. We're gonna talk about nerve later, but anyway, I'm in the middle of the calf. I'm moving down. So nerve is moving like this. Oh my God, I cannot avoid the nerves. Next, above the artery. So here, I'm gonna move to the lateral side of the leg. Oh, so I should change. Same with the screen. Left side is the medial side of the leg. Right side is the lateral side of the leg. That's the fibular. So I'm gonna move from here continuously. So you can see this is the actually medial gastroc, lateral gastroc is meeting. On the yellow, that part is the lateral, that part is medial. Very good. So I'm gonna move so we call that lateral gastroc, but actually that's posterior gastroc. Look at Ray's leg. We are in the posterior part of the leg, right? So I'm gonna come down continuously. You see the nerve is moving continuously. So here, soleus is already coming, right? Soleus. This is gastro, but this is soleus. And then if you pay attention to the fibular, now it's new muscle popping out. Oh, his fibula is so different. Here, so that's the flexor hallucis longus, where the cursor is. See, he's moving flexor hallucis longus. So if I move like this is all flexor. So do you see the three? You can freeze here, right? So, Heidi, where is the gastrocs? Whoops.
Oh my god.
No, you can find out that one.
Let's hear it.
Yeah, good. Yeah. So that's the gastro. Yeah. Soleus. And then flexor hallucis longus. So okay, very good. Unfreeze. So here, I think if you are pediatric physiologists who are watching this video, actually it's very different from children. Children is very easy to differentiate the muscles. Lateral gastroc is here, and then with soleus, you already seeing soleus. And then by the time I come to proximal distal 1/3 from the knee, look at the fibula area, was already flexor hallucis longus came out. Mostly it's on the top of flexor hallucis longus here, but his case is, oh yeah. Can you freeze? And see, you guys can see it, right?
Oh, that's batteries, hold on.
Yeah. Can you, P1, please? And then, unfreeze. Move your big toes one more time for us. Yeah. That's on the top of the fibula. Do you remember? I said Peroneus Longus Brevis is on the top of fibula. But in the posterior part, on the top of fibula is the flexor hallucis longus. So if I move my probe to the lateral side, peroneal muscle popping out, right? Can you freeze that one? MP1? Okay, I'm gonna explain.
Sorry, go ahead.
Oh, we can get another one. Not a problem, madam. Okay, unfreeze. Gastrocs, soleus, flexor hallucis, peroneal muscles popping out, right? Here, we were here, yeah. Stay there. That was from here. Guys, can you see my finger? It's about half over from the knee to the ankle in the middle. So if you want to do flexor hallucis longus injection, you should come down about halfway down from the knee joint and then put the needle above the fibula here, like this. But we're gonna ask him, oh, can I do implant? If your patient has thin leg, yes, implant. Here,
It's already not
it's on. Same thing, same mistake we make continuously. Let's stay here.
cursor.
So as we said, this is the gastro, soleus, and then fibular here. And this whole triangle starts. From the fibula is the flexor hallucis longus. But if you go laterally, the peroneal muscles start popping out here. So don't forget that you always see here, peroneus muscle. Here I'm gonna do. So here, this is the flexor hallucis longus. Along the posterior part, along the fibula, but posterior part of the muscle is the flexor hallucis longus. But lateral part is the peroneal muscles. So if you don't know the relationship, you may hit the wrong muscles, right? Okay. Practice.
Practice?
Mm-hmm. And then why don't you take a whole calf before you have a leg
Take what?
raise? Just take a look, the relationship going
Mhm.
down, take a look carefully.
So I start the
Oh, here, see if you toggle, I just want to make sure. Can you freeze? Where's the nerve? Oops, same thing. Yeah, stay. Unfreeze, unfreeze. Okay, here. Right, that white part, yellow, the white one, right round, that's tibial nerve. So sometimes even when we scroll up and down, we couldn't see it, right? So you have to be very careful. Always nerve along, move along the artery. So when you see the big artery, you have to look for the nerve. Okay. If you don't have a nerve stimulator, you will you can possibly cause nerve damage while you are doing injections.
So now
Okay.
we're seeing lateral and medial gastroc and their junction in the middle. Because I'm
So you-
basically at the knee. Yeah, this one. I think this one.
There's a medial gastro.
Yeah.
We're looking for the junction.
I think
Here.
it was in the middle.
Here, this one.
Is,
This is Soleus. Oh.
yeah.
Oh, here. Oh,
Yeah,
here,
it's
clear,
here.
clear.
Yeah.
This is very clear.
Yeah.
Okay. That was my mistake. But I was right.
No.
Okay.
And then if I go a little bit lateral, then I start seeing soleus
Yeah.
on the
Yeah, it's
lateral
so clear.
side. And then if I go further down,
Now pay attention. Now the reflexalis
I
came
start
out,
to
right?
see
I
the
see it.
triangular muscle next to the fibular, and that's
Well, now Ray is gonna wiggle his toes.
flexor, hallucis, longus. Okay.
Now he's moving Soleus. Go down a little more. Now this is clearly you can see it. Because there was a,
posterior.
they didn't pop up. They didn't pop
It
out
was
yet.
posterior tib.
Yeah.
Wait, that was the next
So
one
posterior
below.
tibialis is going to be like this in between.
Ah,
This is all posterior tibialis.
Gotcha. Now it makes
Now
sense.
actually we are seeing very important. Can you hit the P1? Okay, move your big toes. Okay. So what the reason why we confused is because I kept teaching that above the fibula is the flexor longus, but actually it's not all of them, right? Because in between there's tibia. His leg is so thick I cannot show.
We just need a little bit depth, but basically right now we can see gastrocs, soleus, and tibialis posterior.
No, you see also hallucis longus.
And also,
Yeah, part of it.
Yeah, a little bit. Yeah, especially if I go a little bit lateral, then I can see all four of
So
them.
here, see tibia. What is the tibia here? Right? This is his tibia here. Oh my God, how much we have to go? I don't know. I can't. It's very hard to show. But here, only the part. Okay, big toes. Move your toes. That part is the flexor hallucis longus, and then rest of them are all posterior tibialis. Okay. Do you see the big? No, underneath. Yeah. Yeah, that's all posterior tibialis. So actually that's bone shadow, the tibia part. Oh, it's very, so we call that bathtub muscles here. But adult leg is very hard to, thick leg is hard to show bathtub actually.
Yeah, she's trying to show me where you can see the FHL and then the flexor they'll be separated.
In between.
And
So
then
look at this.
under it will be the
But
posterior tib.
can you move flexor digitorum longus?
In between FHL and what?
The
The
flexor
flexor
digitorum
digitorum.
longus.
Because
Whoa.
the flexor digitorum are come off
So
the
here,
tibia.
but his flexor digitorum longus is here, so that's why you guys cannot see it. It's hard. Here, this, move your toes. Here, flexor digitorum longus, right? Because it's above the tibia. If I move laterally, I'm moving my probe laterally. Oh, here, oh, I can see actually, show a little bit. Can you see, oh, this is, can you
Yeah.
freeze? So, show the fibula. God damn it, no.
Here you go.
Oh, that's tibia. But, okay, unfreeze. I didn't move my probe. See here, you can see two bones. On the left side bone shadow is the tibia. Right side is the fibula. Now, yeah, can you P1? Okay, now he's gonna move his flexor hallucis longus. Okay, now on the right side you see it, top on the fibula. Now move your flexor digitorum longus. Do you see over there? Flexor digitorum longus. Between flexor digitorum longus and flexor hallucis longus underneath, best up is the posterior tibialis. Okay, now you're gonna freeze here. Freeze. And then P1. Okay, I'm gonna review one more time. Hold this one. Oh, Vera, did you understand what I'm saying?
Yeah.
Yeah.
To me, it looks like a chair, though. I apologize.
Yeah.
But to
So-
me, this is a chair, not
Yeah,
a
now I'm
desktop.
gonna measure, I'm gonna draw. This is the cursor. I don't wanna ruin. Okay. Guys, this is the tibia, right? This is the fibula. This, I think I'm gonna measure here. Measure. Here, hit the. This part was the flexor. Oh, good, A plus. Flexor hallucis longus. Okay, now I finish here. How do I finish? Measure. Did measure again, I think. Whoops! Disappeared. Okay, that's okay. And now let's move cursor. Cursor. Okay. Now I'm moving again. This part, measure. This part above the tibia. This part was the flexor digitorum longus. Okay? So, enter. And then I'm going to measure again. How I can do that? I don't know. I want to do two things at the same time. Anyway, then forgive me. I still have to. So make sure this is the flexor digitorum longus, flexor hallucis longus. Now in between this one, best of shape of the this is the posterior tibialis, okay? Now you got it clear, right? So then clear. So this is a gastroc. Gastroc is always hyperechoic, more hyperechoic than soleus. Gastroc, soleus, in between these two muscles, actually posterior, this could be all flex. We have to turn the probe. This muscle could be flexor digitorum longus, extended to here. But in between two muscles, here, this one is going to be in the middle, they are meeting together. And the underneath, best of this one is the posterior tibialis. So this part is going to be flexor digitorum longus. This part is the flexor hallucis longus, extended this much. They meet together.
Yeah, more like
Okay, unfreeze. I'm going to unfreeze. We find out that part. Oh, good. Now, this is the flexor hallucis longus. So move your big toes one more time. Over there, right? Bring it, scroll down a little bit. More. Now bigger, right? So here, now you guys can see tibia, fibula, and then flexor digitorum longus. It's very hard. Far. The other side. Yeah,
Here,
it's hard. Yeah. Because he was able to show us a little bit. Move your big, see here. So this thing is moving together. I think he moves the hallucis longus at the same time, digitorum longus. So it's moving together.
Makes sense.
Yeah. So when you do the injection to flexor hallucis longus, you have to go to middle calf, fibula side on the top of fibula. I'm gonna, when I make the PowerPoint, I can show Where's my needle? The big toes is moving. I have that video. I can show that. So because his leg is thick, that's why it's, but children is very clear. Clearly you can see
Yeah,
the
you can
difference.
easily do here. Like that's right.
Midline.
Yeah. Yeah.
That's how the system. Very good.
Alright.
Okay.
We should be finishing.
Oh, we almost done?
It's 8.
Oh my goodness. Okay,
But that's a good
that's good.
chunk of information, yeah.
You both got the same.
Yeah,
Yeah.
I think next time maybe
Vera,
the
yeah.
Vera or Heidi's leg.
Sure.
We can
Yeah.
do. Okay, thank you everybody. We're gonna finish. Have a good day.
And we'll just bring shorts from
Yeah.
home. So we're
I'll
gonna
look